Good afternoon, and thank you for joining us today. My name is Carol Green, and I'm the president of the Canadian Society for Medical Laboratory Science. I'm here today with our executive director, Christine Nielsen. CSMLS is the national certifying body and professional association for medical laboratory technologists and medical laboratory assistants. Whether it's a blood test, a throat swab, or a biopsy, tests performed by medical laboratory professionals provide vital information about your health. Doctors depend on laboratory test results to accurately diagnose and treat illness and monitor patient health. In fact, up to 85% of decisions about diagnosis and treatment are based on laboratory test results. Members of the CSMLS board and staff are in Ottawa today to meet with members of Parliament to discuss critical health human resource concerns as they relate to medical laboratories in Canada. This afternoon, I would like to bring to your attention the critical role of internationally educated medical technologists, or IEMLTs. Medical laboratory technologists, or MLTs, conduct sophisticated laboratory tests on blood, body fluids, and body tissues. They also interpret test results. Test results provide critical information used by doctors to diagnose and treat illness and to maintain their patients' health. The CSMLS recognizes and applauds the federal government for its continued work to accelerate and expand the assessment of internationally educated health professionals. However, there is still much more to be done. The integration of international educated professionals into the Canadian workforce is a significant challenge for all healthcare professions, including medical laboratory technology. CSMLS is committed to ensuring their credentials are assessed fairly and efficiently, while at the same time safeguarding the integrity of the national certification process. With the exception of Quebec, MLTs across Canada require CSMLS certification as a condition of licensure. CSMLS conducts a prior learning assessment, or PLA, to evaluate the credentials and work experience of IEMLTs to determine if they are eligible to write the CSMLS National Certification Examination. Over 90% of the more than 300 IEMLTs who apply annually to the PLA process are not equivalent to the Canadian standards. Furthermore, the failure rate for internationally educated professionals who challenge the CSMLS National Certification Examinations is significantly higher than that of graduates of accredited Canadian training programs. A 2004 pilot research study found that internationally educated applicants who had completed a bridging program had a pass rate comparable to graduates of accredited Canadian training programs. And most recently, a report produced by the CSMLS offers the first clear evidence that sustained government funding of bridging programs for internationally educated medical laboratory technologists is good fiscal policy. The report, entitled Bridging Programs for Internationally Educated Medical Laboratory Technologists, a Business Case, was funded by the Government of Canada's Foreign Credential Recognition Program. Christine?
Thank you. Researched by the Center for Spatial Economics and authored by Dr. Moira Grant, CSMLS Director of Research, the report concluded that bridging programs shorten the time for IEMLTs to become certified in Canada, decrease their financial hardships, and expedite their integration into the Canadian laboratory workplace. As a result, internationally trained technologists contribute to the Canadian economy much sooner and with the support of a bridging program. There is a growing shortage of medical laboratory technologists in Canada, and CSMLS consistently receives about 600 self-identified IEMLTs through immigration annually. The practice of medical laboratory science, however, varies greatly around the globe, and it is a requirement of all practitioners in Canada to meet the rigorous entry to practice standards, putting patient safety first at all times. A system that allows for additional training or practice in the Canadian context that is accessible, affordable, and reliable is imperative. Supporting internationally trained technologists through a government-subsidized bridging program addresses both healthcare resource challenges and the need for equitable treatment of newcomer professionals to Canada who expect employment in their field. We strongly urge the Government of Canada to introduce targeted, long-term, and sustainable funding investments for bridging programs for internationally trained technologists. Through these critical investments and through the development of proper resources and best practices, qualified professionals will be able to enter the workforce more quickly. Our announcement today signals the need for the Government of Canada to take a more proactive role in developing a strategy for the medical laboratory profession. We need the government to focus on and recognize the important role of medical laboratory professionals in Canada's healthcare system. Thank you for your time. We would be happy to answer any questions.